About the middle of August, I noticed my pants were fitting a little snug around my waist, and I started feeling bloated. And then about a week later, I started feeling pain in my abdomen. I waited about 2 weeks until the pain was unbearable, and I knew I had to go see a doctor. My name is Renea Cross. In September of 2015, I was diagnosed with primary peritoneal carcinoma. My primary care physician, when he called me, he said he had already contacted Dr. Kane, who's an oncologist, and that I was going to go see him the next day. He told me that I had the primary peritoneal carcinoma and I was stage 3C. And it wasn't a good outcome at that point.
I called up Dan Tobias, who's a GYN oncologist who practices at our Overlook and Morristown campuses. He did what we call an optimal surgical cytoreduction. Basically, in lay terms, that means he removed all of the cancer he could see.
When I met with Dr. Tobias, my surgeon, I had explained to him that my son's wedding was in 5 weeks and that I didn't want to miss that wedding. And he assured me that we would do the surgery the following week and that I would be there to dance at my son's wedding. And I was, and I'll be forever grateful for that.
Doing the surgeries is really all about helping patients and helping them get back to their normal life. And, in her particular case, it was very important for her to be well for her son's wedding, and it's great to hear when patients are able to make those life events.
Well, my first experience was with Overlook, and then I had the surgery at Morristown, my chemo at Chilton, and my new last shots at Newton. So I got to experience all 4 locations, and the care in each one of the places was wonderful. I couldn't have asked for better help and treatment. The first day of my abdominal chemotherapy, the head nurse from Oncology from Morristown and also from Overlook Hospital came to oversee this type of chemo being done because it's not done very often.
We make every effort to be certain that patients receive the same world-class care regardless of where they enter the system. Morristown, Overlook, Chilton, Newton, or Hackettstown, we understand it's a very difficult experience for women to go through, and we make every effort to provide them with compassionate care and support them through every step of the way.
2 nurses, Michelle and Sandy, have become personal friends and close personal friends. It was a horrible diagnosis, but it was a wonderful experience. Because of the nurses and the doctors, the social workers, the dietitians, I would highly recommend Atlantic Health System to anyone with a medical need.